If your young athlete is sidelined because of pain, you might want to find out if a growth plate injury may be to blame. These types of injuries that occur more often in the summertime can affect a child's development.
Morning, Clay. How are you?
I'm good.
Clay Russo's a promising young catcher, but at the age of 13, he's sidelined with his first major injury.
My arm started hurting, and after practice, I'd have to ice it and take painkillers because my arm would hurt really, really bad after a baseball game.
This is a femur bone, and there's a growth plate at the end of the bottom here.
Orthopedic surgeon Robert Baylis diagnosed the young player with a partially torn ligament in the right elbow that's affecting the growth plate.
And this whiteness in the bone here is edema around the growth plate, indicating evidence of a fracture. Luckily, his growth plate is not displaced.
A third of all growth plate injuries occur in competitive sports like soccer or baseball. With any growth plate injury, it's important to have an early diagnosis.
The risk we take of having him play through this and not paying attention to it is the growth plate can be injured and thereby affect his growth.
The most common growth plate injuries are in the hands and feet, including wrists and ankles. Treatments include surgery to put bones or joints back in place, exercises to strengthen the affected area, or immobilization. Baylis chose to keep Russo off the field for a couple of months.
Good deal.
Right now, I just have to take about 2 months off, and the end of summer, I should be able to go back to throwing.
And we wish him the very best. Signs your child should go to the doctor include the inability to play because of pain, visible malformation of a child's arm or leg, and severe pain that makes it impossible to function normally. Obvious reasons there.
Yeah, and it's tough at that age to say, no, you can't play the sport.
Right, and they're like, it's not so bad. I can go, I can go.
Check out with the doctor.